Great, so we're going to tell you two stories. We've tried to dovetail them, so you can tell us how that goes after. We're going to start with a story about nail salons that is work that we're doing at OCRC in collaboration with CRE-OD and several other groups, as you'll see. But for those who maybe haven't thought about it, nail salons have proliferated a lot recently. In the city of Toronto, there is, they say, over 3,400 is the number from Toronto Public Health. And the workers in these salons are often women, and they're often new to Canada. This, in many cases, is their first job when they arrive here. But the workplace is not without hazards. There's a lot of chemical exposures, biological in terms of infection, physical hazards. There's UV lamps in these workplaces that are curing both polishes and artificial nails. There's ergonomic concerns and psychosocial issues happening. So mostly we know things about these hazards, but we don't know what they're like in this particular workplace. There's also a lot of challenges for prevention, as you can imagine. There's a language barrier in a lot of cases. There's a lack of awareness around occupational health and safety. And the workers themselves don't have to be licensed in Ontario. That's not the case in other jurisdictions in Canada. And they're also not organized, so they're not an easy workforce to access in terms of education or awareness. So in 2013, the Parkdale Queen West Community Health Center, that's that long acronym out there, they have health promoters on staff there that identified there was a problem. They had women coming into their downtown CHC that were working in nail salons that had concerns about their health. And so the following year, the CHC actually took the initiative in collaboration with the National Networks for Environments and Women's Health that used to be based at York to establish the Healthy Nail Salon Network in Toronto. And so this is a volunteer, community-based organization. And you'll see on the right there that it includes a lot of groups that maybe don't traditionally talk to each other. So we have OCO at the table. We have the South Asian Legal Clinic at the table. We have advocacy organizations. We have workers themselves. We have folks from Toronto Public Health, from the Centre for Research Expertise in Occ Disease, as well as myself from the OCRC. And so together, the goal really is to improve the health of nail salon workers in Toronto. And the organizations are working together on some things, but also taking ideas back and working on things individually and bringing them back to the group, both for improvement or feedback and also for dissemination. And so a lot of activities have actually happened in a short amount of time. There's been literature reviews, a qualitative study of the barriers to occupational health and safety among these workers, and there's been an analysis of the Toronto Public Health Body Safe program data done by Deandra Budd, who is here, and that's the inspection program that these salons are subject to. We've also created some training modules with support from the MOL's OSPIP program, and we have there were workshops and resources developed. Lynn has brought along a selection of these. They're translated into simplified Chinese and Vietnamese, which are the two primary languages of the workers that we're working with. And we also are undertaking an exposure study in nail salons in Toronto, and that's funded by the MOL's ROP program. And I've put a link up here for those who can write quickly. This is at the CHC's website, and it does include both these resources as well as other materials that have been produced by various partners in the network. So I thought I'd give you just a little snippet before we transition to Peter's work. But when we did the workshops, the skin workshops have been done, the reproductive health workshops have been done, and we're moving now into doing musculoskeletal and respiratory health workshops. But following the workshop, the question really is, does this have an impact? And so a year after the workshops were done, the same salons where the workshops were given were revisited and surveyed to see if their practices had changed. And as you can imagine, there's huge turnover. So although the salons were the same, the workers were not always the same. And what we got from these surveys is that there was some shift in glove use. So actually a lot of latex gloves being used in nail salons. And so that was a real key piece of information we were trying to get across, is that that's not the best. It's, latex is an allergen, but also it's not the most protective glove for the chemicals that they're using in the salon. So there has been some indication that there's a change in the glove use, the type of gloves that they're using, but there's still a lot of concerns from these workers. So they're concerned about chemicals on their skin and in the air, and they're concerned about infections, transmitting them from the clients to themselves. A lot of issues in terms of raising that when you're a worker if a client sits down and has some sort of infection, and how do you address that problem? And they also have a lot of symptoms. So despite their concerns, the highest concerns being around chemicals, the symptoms they report are really musculoskeletal, and eye strain was a big one that really wasn't on our radar, I think is fair to say. So these are things that we're considering as we go forward in the work that we're doing with the community. And I thought I'd tell you just a little bit, this is still very much a work in progress, but the other piece, or the other large research piece that's happening is the exposure study. And this work really, the gap in our understanding of the exposures in nail salons was identified by the network itself, and we developed the grant. We submitted it and we're successful, and so we're now working to recruit salons. We've got about 10 committed so far, which is actually really good. Seems like a small number, but it's really good from our standards, and we're using several methods to recruit. We have community members actually knocking on nail salon doors every week. They walk around neighborhoods in Toronto and talk to people and ask them to participate. And they've been hugely successful so far. And we're also working with Workplace Safety and Prevention Services, who are reaching out through their personal services committees to identify nail salon owners who might be interested. And we're looking at a wide variety of exposures here, both chemical, ergonomic, and a little bit of stress. So there's a lot of challenges, as you can imagine, when we are trying to do research with workers in precarious or vulnerable working conditions. These are small, independent businesses. Many of the owners themselves are new to Canada. There's really low awareness around the regulations and the rights and responsibilities of all parties. And I know that the MOL just hosted a seminar on this, and there was good uptake from our network in terms of getting more information. The industry itself really hasn't been traditionally well integrated into occupational health and safety, so it's not a group that we think of immediately when we're talking about some of the hazards that they actually face in the workplace. I think the other piece, we've talked a little bit about surveillance earlier, but these workers are really unlikely to be captured in traditional occupational statistics. They're not going to be covered by compensation, so we're not going to see them in places where we normally look for problems. And even though we think this is great, we're out in the field and we're getting some real exposure data on what's happening, the health concerns that these workers have that I haven't really touched on include things like reproductive outcomes, miscarriages, time to pregnancy, cancer, and those types of health concerns can't be addressed in small field studies. We really do need a larger, ideally, large population studies in order to appropriately investigate the concerns that the workers have, so we're not there yet. And then I'm going to hand it over to Peter.
Thank you. This is my weak attempt at trying to link our two presentations together. So I think, a lot of the times we talk about occupational health and safety vulnerability, and Victoria's sort of discussed, vulnerable workers being nail salon workers. But I think what we're trying to do at the Institute is come up with a better definition of what it actually means to be vulnerable. So a lot of the time we talk about vulnerability as in nail salon workers. Maybe it's because they're recent immigrants, maybe it's because they're in small businesses. And that's how we describe vulnerability. We sort of use these types of characteristics to describe who's vulnerable and who's not. But it doesn't get at the key concept about what makes these workers vulnerable. And I think, when you listen to Victoria's presentation and about the issues that she's bringing up, it's not actually about working in a nail salon. It's about being exposed to hazards and not having the ability to control those hazards, which is what makes these workers vulnerable. So we've come up with an alternative definition of vulnerability. It's not really an alternative definition. It's actually the definition which was originally stated in the Dean report, which is when a worker is exposed to hazards without the ability to control those hazards. All we've done is go a step further and think about what are the controls that are in place for workers if they want to somehow ameliorate the hazards that they're exposed to. And so we've developed a measure which captures exposure to hazards using 9 questions. These are general hazards. When we work with particular workplaces, we can supplement specific hazards within a particular industry or workplace into this. And then we focus on 3 different protections. One are policy and procedures, one are occupational health and safety awareness, and the last one is empowerment to participate in injury prevention. So policy and procedures are things like just training given to workers when they change jobs and when they start a job. Awareness is about the employees' awareness of their rights and responsibilities and their employers' responsibilities. And empowerment are things like, if they noticed a hazard, would they say something about it? Are they involved in decisions which are made around occupational health and safety in their organisation? And so using these questions, we can classify workers into 4 groups. We've got the least vulnerable group, which are workers who are not exposed to hazards and have adequate protections which are in place. We have the most vulnerable group, which is where workers are exposed to hazards without adequate protections in place. And then we have groups which are somewhat vulnerable. So when there's some hazard exposure but adequate protections are in place, or when there are no hazard exposure but the protections are inadequate. So if hazards developed in the organisation or if there are hazards the worker's not aware of, they would actually be vulnerable. And using this measure, we've sort of learned different things about vulnerability. So because we've got 3 different types of protections, we can look at vulnerability in 3 different ways, plus an overall type of vulnerability. So this is describing policy and procedural vulnerability, which is where workers are exposed to hazards with inadequate policy and procedures in their workplace. That's the blue columns. The red is where workers are exposed to hazards with inadequate occupational health and safety awareness. And the gold is where workers are exposed to hazards with inadequate empowerment. And so this is across organisational sizes, so from less than 20 employees to 500 or more employees. And you can see when it comes to workers in different size organisations, what sets the workers in the small organisations apart from the workers in the large is because they often have inadequate policy and procedures. In terms of occupational health and safety awareness, there's not as much of a gradient, but there's still one there. And in terms of empowerment to participate in injury prevention, the workers in the small workplaces actually look very similar to the ones in the large, and it's actually the mid-sized group, 20 to 99 employees, which is where vulnerability, empowerment-related vulnerability is most pronounced. And we've done a variety of different studies. We've also looked at workers who are in temporary employment relationships, which are vulnerable in all 3 ways. And we've also looked at recent immigrants, which are mainly vulnerable around empowerment and to a lesser extent policy and procedures. So what could we do if we started to refine our definition of vulnerability and we actually focused on making all workers in Ontario, who are exposed to hazards to have adequate protections in place? Well, we could sort of refine our targets of primary prevention. So here are 4 groups of workers, and you can see the highest injury rates here are in the group which are red and the group which is blue. The group which is red and the group which is sort of that funny green colour, they're both new and young workers who we commonly sort of focus on as vulnerable workers. And the group in the blue and the grey are people who are not new and not young. And what we've got here is the proportion of workers who are physically injured in the last 12 months. So you can see here, when we focus on just the new and young, we tend to focus on a group of workers who are in this sort of greenish group, which are potentially at a lower risk than this group of workers who are in the blue group, who are not new or not young. And similarly, if we focus on high-risk industries, so people like healthcare, construction, manufacturing, some of the primary producing industries, we get the same pattern where there's a group of workers who are not working in high-risk industries, which actually have a very similar injury rate compared to those who are working in the high-risk industries. So what sets these workers apart? Well, it's that these 2 groups, the red and the blue, are those workers who are exposed to hazards without adequate protections in place. So regardless of whether you're new or young, if you're exposed to hazards with inadequate protections, you're a vulnerable worker. So it's not about describing demographics, it's about describing the type of work that these workers do. So just some key messages. So vulnerability is not about who you are, it's about the work you do and the protections that are in place to protect you in your organisation. We've got a 27-item measure that can be used to assess different dimensions of vulnerability at the level of the worker. So this is a survey that can be given to workers, which is one of the challenges when it comes to accessing vulnerable workers. You can't really go through organisations. Organisations who have workers who are exposed to hazards without protections often don't let you in the door. But when you do a worker-based survey, you can actually approach workers outside of their workplace. We could think about a situation where we could conduct regular surveys of workers, and that could inform our primary prevention targets. So we could actually know where, geographically where workers are who are exposed to hazards without adequate awareness. We could know across which types of industries are most common for workers to be exposed to hazards without adequate empowerment. And we could actually then focus on reducing vulnerability instead of reducing claim rates, because claim rates can go up and down for a variety of different reasons. So some more information. The key one, I think, is if you go to our website, www.iwh.on.ca/ohs-vulnerability-measure. You can download the measure for free. You can get some instructions on how to administer it in an organisation. You can look at some videos, and you can also access some of these articles. Thank you.